Today we're going to discuss the ABCs of Part C of Medicare, what's called Medicare Advantage plans. Be sure to stay tuned to the end of the video for our free offer, so don't touch that dial. Hi, I'm Tim Hanbury, author of Medicare Blueprint. Original Medicare has some significant out-of-pocket costs, and in this video we're going to show you how a Medicare Advantage plan can help lower your out-of-pocket costs. So let's get started. The first thing to know is that when you choose a Medicare Advantage plan, you're replacing or transferring original Medicare Parts A and B to a private insurance company. Because of that, all the benefit and claim payments are handled by the insurance company, not CMS. And CMS means the Centers for Medicare and Medicaid Services. This is the federal agency that handles Medicare under the Department of Health and Human Services. Under original Medicare, all benefits and claim payments are made by CMS, not the insurance company. Under a Medicare Advantage plan, this is reversed. What Medicare does is it pays a private insurance company what they would normally spend, on average, for a person who is on Medicare. According to the Kaiser Family Foundation, the average cost for a person under Medicare is somewhere between $12,000 to $15,000 per year, depending on where you live. Insurance companies are required by CMS to cover the same items as original Medicare. They may also cover additional items that are not normally covered by Medicare, like routine dental or routine vision services. Advantage plans, like most employer plans, are network-based plans. And of course, you're still required to pay your Part B premium under all Medicare Advantage plans. Sometimes people get confused and will tell you that you don't have to pay your Part B premium. This is simply not the case. In addition, you must live in the service area that the plan is offered in. And this can be a specific county, it can be statewide, or it can be several states together. Most Advantage plans offer prescription drug coverage as part of the Medicare Advantage plan. Keep in mind that the prescription coverage under a Medicare Advantage plan has the same structure as a separate Part D prescription plan. The way they cover prescriptions is no different under a Medicare Advantage plan than if you purchased a separate Part D prescription drug plan to go with your Medigap plan. Medicare Advantage plans usually have low premiums, less than $50 per month, and there may be several zero premium plans available. These plans have a single price, which is not based on your age, nor can they exclude pre-existing conditions. However, you must renew these plans each year, as they will change. Prices for plans and for services can change, doctors will go in and out of networks, and prescriptions they cover can change yearly also. Lastly, Medicare doesn't allow you to have both a Medigap and a Medicare Advantage plan at the same time. Now, there are two main types of Medicare Advantage plans, HMOs and PPOs. Most people will recognize these two types because it may be the same with your employer's plan. With an HMO plan, you have to make sure that the physicians that you want to see are participating with the plan. If they're not, and you don't get permission from the health plan to see them, then the Advantage plan won't pay the claim. You'll be responsible for the costs. Also, most HMO plans will require a referral from your primary care or family physician to see a specialist. Because of these restrictions, in most cases, the plans that are available for a zero premium tend to be HMO plans. A PPO, or Preferred Provider Organization, allows you to see physicians and hospitals who participate with the plan, but you can also see non-participating physicians and hospitals. However, there can be some additional cost to do so. In addition, most PPO plans won't require you get a referral to see a specialist. Generally, we would recommend you consider a PPO Advantage plan over an HMO plan unless you're very comfortable with the network of physicians and hospitals. In most cases, you won't receive permission to go outside of the network. So let's look at a small sample of a typical Medicare Advantage PPO plan. And what you see will remind you a lot of an employer's plan. You'll have an office visit copayment. In this case, $10 for a family physician and $45 for a specialist. If you go out of network, then there's a $20 copayment for a family physician. One thing that's different from an employer plan is how they charge you for a hospital visit. Instead of an annual deductible, it'll have a per day copayment up to usually 4 to 6 days. If you stay in the hospital longer than that, you won't have a copayment. Lab tests, x-rays, emergency rooms will usually have a copayment. Be aware that in many plans, expensive testing, such as MRIs or chemotherapy drugs, require that you pay a percentage of the cost up to the maximum out-of-pocket amount. In this example, you'd pay 20% of the cost up to the maximum of $6,700. Plans can have lower maximums, so be sure to look at this when evaluating different plans. And you can join a Medicare Advantage plan when you're turning 65 or during a special enrollment period. And you can switch to any other Advantage plan each year during the annual enrollment period, or AEP, which is from October 15th until December 7th each year. And this is why you see all those half-hour infomercials from the insurance companies each fall. This year, CMS has changed what they call the Medicare Advantage disenrollment period to what they now call a Medicare Advantage open enrollment period. While all these enrollment periods can make your head spin, this one's good news. Before, you could change back to original Medicare if you didn't like the Medicare Advantage plan, if you notified CMS between January 1st and February 15th. They have extended that from January 1st to March 31st. If you switch back to original Medicare, you can also join a standalone Part D prescription drug plan. What's new here is that this change will also allow you to have a one-time only chance to switch from one Medicare Advantage plan to another during this 3-month period. If you make a mistake and pick the wrong plan, you can switch to a different plan during this period. Okay, so what should I be looking for when considering a Medicare Advantage plan? Well, first, you need to look and make sure the physicians and hospitals that you want to see are participating with the plan you're reviewing. If it's an HMO plan, make sure your doctors are participating. Otherwise, you'll be paying for these visits yourself. If it's a PPO, you should still check to see who's participating with the plan so that you'll know what your cost will be. The good news is that there's normally several insurance companies to choose from, so you may find more than one plan that includes your physicians. The other item to check is a list of covered prescriptions, or what is called a formulary. Make sure your current prescriptions are covered and know what the cost will be. Failure to check on this can cost you thousands of dollars, or you may simply not be able to afford the current medications you're on. So why choose a Part C Advantage plan? First, it's an affordable option for many people. It's easy in the sense that you don't usually have to purchase a separate prescription drug plan because it's included in the Advantage plan. And unlike original Medicare, the plans will have a maximum out-of-pocket which can be no more than $6,700. Advantage plans can and do offer additional benefits like some routine dental, vision, and hearing benefits. You may also have heard of Silver Sneakers, which is a fitness program for members that is paid for by the Advantage plan. Medicare Advantage plans also offer additional benefits for people who are eligible for both Medicare and Medicaid. Medicaid is insurance for low-income individuals, and we call these plans dual eligibles. They also offer special need plans, which have additional benefits for people with specific health conditions. These conditions vary by state, but are usually for things like diabetes, severe heart conditions, and mental health issues. And these can be excellent options for individuals who qualify. And lastly, in many states, it may be the only choice available for individuals who are disabled and under age 65. Many states don't require insurance companies to offer Medigap plans for individuals who are disabled under age 65 and on Medicare. So many people are amazed with the amount of mail that they receive on Medicare before they turn 65. And the reason you receive so much mail is that there are several regulations designed to protect you. Insurance agents can't show up at your door, nor can they just give you a call. The rules only allow an agent to call you if you first responded to them in some form. Now, I've told people this before, and they almost always tell me that they receive calls regardless, and that can be true, certainly. Insurance companies and what are called call centers can call you provided they follow strict guidelines. When an insurance agent meets with you, they can only talk to you about Medicare health or prescription plans. They can't talk to you about things like life insurance, annuities, or long-term care plans. If you want to find out about these plans, you have to set up another appointment with them. Agents are also required to have you sign a scope of appointment form, which outlines these regulations. Now, in the past, you had to sign this and then wait 2 days before the appointment. CMS has changed that starting in 2018 so that when you meet with an agent, they'll ask you to sign this form. It's okay, they're required to do this, and you're not buying anything by signing this form. As you can see, Medicare Advantage plans are another way to lower your out-of-pocket costs with Medicare. If you have any questions, please comment and we'll reply or cover your question in an upcoming video. If you'd like to stay informed on everything Medicare, please subscribe to our channel. Thanks for watching the video, and as promised, click on the link in the description below to get your free offer.